Hello, I'm Mia Cifuentes, and today we're going to talk about talking to your doctors and others on your healthcare team. To make this easier to do, we're going to use a model called the 4 M's. Today we're going to learn about a model you can use to help you communicate with your doctor, a nurse practitioner, and other members of your healthcare team. We'll talk about how using this model can empower you to advocate for yourself. Can some of you share how you feel when talking to your doctor, nurse, pharmacist, social worker, and other professionals? Examples include, they don't listen to what I'm saying. I don't understand what they're saying. This is too confusing. Before we go into more detail about the 4 M's, let's go over some of the terms we'll be using today. Our definitions and yours may be different, so let's make sure we're on the same page. Healthcare providers. These are some people you go to for healthcare, health resources, and health services. These include doctors, nurse practitioners, nurses, pharmacists, and social workers. This also includes services offered by your community center or senior center. Healthcare team. Your team is made up of all your healthcare providers. Healthcare plan. This is the plan you've set with your healthcare providers to live your life to the fullest. This is not the same as a health insurance plan. As you get older, things change, which makes making decisions about your healthcare. The 4 M's helps you communicate with your healthcare team about your health goals. It helps you to understand your health and your healthcare team to understand your values and beliefs. The 4 M's helps you to make informed decisions for your healthy future you want to have. The 4 M's are what matters, medication, mind, and mobility. Let's go into detail about each one. How does what matters to you affect your healthcare? Providers should care about how I want to live my life. I should be able to understand how my treatments, diagnosis will affect my life. You should tell your doctor what matters to you. They should help you to make a healthcare plan that fits your goals and respects your values and beliefs. Asking questions is an important part of understanding this plan. Ask questions like, what should I expect from this treatment? What are the side effects of this medicine? How will this affect me and my lifestyle? It's a good idea to bring a list of questions when you meet your provider. Remember, you should understand all possibilities before you make a choice, so you can live the healthiest life you want to live. Tip: ask your doctor about advance directives. This is a written document that shows what you want if or when there's a time you can't make your own decisions. The next M is medications. How does this fit into what matters to you? I don't want to take anything that stops me from doing what I want to do. I want to know what I'm taking and why. Do I need to take all of these medicines? Your medications shouldn't keep you from thinking clearly or doing daily tasks. Also, your doctor shouldn't prescribe certain medications to you because they have bad side effects on older adults. Your doctor should know what these are. Ask your doctor questions about the medications they be prescribing, including, why are they prescribing it? Does one drug affect another? What side effects should I expect? Are there any warning signs to look out for? When you see your provider, bring a list of all your medications you're taking, or bring all your medications with you, whichever is easier. Your list should include medications prescribed by other providers, over-the-counter medicines like pain relievers and vitamins, natural medicines. Remember, what matters opens the door for communication with your provider. This includes being clear about what to expect from medications. So far, we've talked about what matters and medications. Next, we'll talk about the mind. How does your mental state fit with what matters to you? Should I be worried that I'm forgetting things? I don't want to take anything that clouds my mind. Forgetfulness, confusion, and long periods of sadness are not a normal part of aging. Talking to your doctor about these symptoms early means treating the cause early. This means being able to better handle the disease. Talk to your doctor or other healthcare professionals about ways to prevent mental symptoms. This can include taking your medications, changing your diet, exercising. Your provider should do annual screenings for dementia and depression. Remember that list? It can include questions or concerns you may have about your mind and emotional state. Finally, let's talk about mobility or movement. This is the last M. How does what matters to you affect mobility? Being able to go to places and do activities I want matters to me. What can I do to move more? Continuing to move is important as we age. Your healthcare team should work with you to make sure you're able to move to the best of your ability. They can offer services, resources, and treatments to keep you moving. This includes looking at your range of motion during a physical exam or doing a home checkup for obstacles or fall risks. Bring questions about how to get around your home or from going from place to place. Ask if there are any exercises you can do to stay strong and flexible and improve your balance. If there are any activities you want to do, talk to someone on your healthcare team about why doing it is important to you. They can help you find ways to do the activity even if it is modified. Resources like a community or senior center may also have other activities you can enjoy. Key points to remember are: your healthcare provider should honor what matters to you when you are making the healthcare plan. Your medication should help you, not stop you from doing regular activities. Treat changes in your mental state as possible signs that something bigger is happening. Let your healthcare providers know about these changes. Your mobility should be encouraged and supported to let you know what matters to you. Look at the 4 M's as a guide to help you to speak to your doctors, nurses, pharmacists, physical therapists, social workers, and other healthcare providers. This guide empowers you to make decisions about your health and advocate for yourself. Thank you for coming today. We hope this program was helpful to you.